which means the Western scientific medicine is not really scientific, if you want to know. But based on these, the class system started. Western medicine is scientific, all other things not scientific. One day I was giving a lecture in IIT Bombay, and they had invited me to give a lecture on blood pressure. IIT, you know, IIT is all supposed to be very brilliant boys and girls and brilliant professors. So lecture went on. So I told them, what is blood pressure? A physics teacher in the class, PUC class, tells the student, laminar flow cannot exert lateral pressure because if it does, then it can't flow. Cosine 90 is 0. Right? Yeah. Mucks up. Passes CET with very high rank. Gets into the medical school. Physiology professor comes, class. Lateral pressure exerted by the flowing blood is called lateral blood pressure. That's blood pressure. Lateral pressure exerted by the flowing blood on the vessel wall is called blood pressure. I said, what is this? Where do these two things go? Second thing is, does the blood flow laminarly inside the blood vessel? Supposing you have an obstruction of the blood pressure, we say, oh, it's very bad obstruction. Have you heard of the Bernoulli effect? As a matter of fact, the blood flow may be better with a little obstruction. I was telling Karthikeyan Saab that the obstruction to the coronary arteries. See, with the simple three things we didn't ask ourselves. Why don't animals get a heart attack? Why only man should get a heart attack? Have you ever thought about it? Number two, coronary arteries fill in diastole, not in systole. So the pressure head is so low that why should coronary arteries have atherosclerosis? I can understand the carotid arteries, leg arteries having, because the pressure is high, systemic pressure. Here diastolic pressure. So if you ask these three questions, it will be very clear to you that atherosclerosis is not a disease at all. Atherosclerosis is a good thing that the body does to band-aid an injury to your vessel wall. It's a beautiful band-aid. Actually, Valentin Fuster, a very famous cardiologist, interventional cardiologist in Washington, has written, I quote, he said, less than 30% of the infarct-related coronary arteries are more than 50% blocked. Did you understand that? Less than 30% of the infarct-related vessel means the vessel which supplies the heart attack area, which you say blocked, are less than 50% blocked. So bigger block is not important, lesser block is important. And if you go deep into it, you find out animals do not get a heart attack because animals can produce vitamin C in their system. You and I get a heart attack because we don't have capacity to produce vitamin C. So heart attack possibly is a younger brother of scurvy. You have heard scurvy where you bleed everywhere? Here you bleed into the vessel wall and then the vessel wall gets blocked and then heart attack comes. I mean, we don't think. Every newborn child wrote, Alexis Carrel, a Nobel laureate surgeon who taught surgeons how to stitch blood vessels. He wrote, every newborn child is a genius, only to be converted into an idiot in school. Because he stopped thinking. Otherwise, a student who is supposed to be a good student, quote unquote, who gets highest mark is called a good student, no? He's the best mugger. Who has said cosine 90 is 0, how can he accept the physiology professor saying that cosine 90 is the cause? Then one professor of physics got up during question hour. He said, you're a brilliant lecture. I too don't believe in this blood pressure and all. I don't take medicines for that. But you mentioned Ayurveda. That's scientific. Then you are a quack. I don't want to listen to you. This is the attitude of a professor in the IIT of physics. So I told him, sir, I'm so sorry. You are a professor in IIT. He didn't like that. He was very angry. I told him, I thought professors in IIT we are wise people. You are a knowledgeable man in your subject, but you have no wisdom. Because you don't know what Ayurveda is. And you're talking about a thing you don't know. And Ayurveda probably has got the strongest scientific base because it depends on non-linear mathematics. Ayurveda depends on non-linear mathematics. And Ayurveda probably has the best base of, and Ayurveda is a beautiful idea. It's not the idea of, Ayurveda's idea is life positive. Swastasya, swasta, Rakshitam. Preserve the health of the well. From the community point of view, very economical model. On a given day, about 2% of the people will be sick. 98% are well. If you can try and preserve their wellness without getting them to go into sickness, won't you save millions and millions and trillions of dollars? Now, you all want cancer to go away from this world, no? Is that right? Anybody wants cancer to be here more? More? No? A lot of people want cancer to be here more. Government has permitted 240 chemicals to be used in various human things, including eating things, which are all carcinogenic. I'll give you an example. Many of you don't have lipstick. You know the lipstick you put? It's got so many pro-estrogens that a study recently showed that the western breast size has increased one size more. 30 size has become 31 in the last 25 years because the pro-estrogens in lipstick. I wrote to the airlines here. I wrote to, what's his name? Goyal. Because he insists that the air hostesses put not lipstick once, but before each flight they must put the lipstick. Otherwise they are punished for that. And the supervisors see and say, your lipstick is not up to the mark. So I wrote to him, don't kill your girls. After all, why lipstick? Probably people don't know the history of lipstick. Did you know that? How many of you know the history of lipstick? Nobody? Shall I tell you?
Yes, please.
Secret. The prostitutes in Paris, they were not selling their wares by, exposing themselves. They were putting the color of their vagina onto the lips, so to sell that idea to the prospective customers. That's how lipstick started. Different colors. Jodi, I should not have said that. Anyway, unparliamentary, but that's exactly what it was. And we promote that today. A newborn baby in America today has 242 chemicals in the umbilical cord, which means it has come from the mother. Now, are you really thinking of curtailing cancer? I don't think so. There are 4,000 articles which are not published, hidden, not published under the carpet, which say eating meat regularly makes the body system acidic, and that's one of the very important causes of cancer. Did you know that? You knew that? I see, I didn't. Government permits that. Government helps you that. You know the scent you put, puch and all. It has got so many chemicals, carcinogens. You put sunscreen, there's an advertisement, don't go in the sun, you will get skin cancer. If skin cancer were due to sun's rays, every dog, every buffalo, every cow should have had skin cancer and become extinct. Because you expose only some parts of your body. The whole back of these quadrupeds expose the sun, all the time he is out. It's a great thing. Eh? We saw that Swamiji now has changed little. Karthikeyan's house, he was doing a scientific study on a Swamiji. He will not eat anything. And Kalamma, Karthikeyan's great wife, was alive those days and she was keeping a careful watch on him. He'll not take any food. Stand there for 4 hours and look at the sun without batting an eyelid. And his eyes were examined in Moorfield Eye Hospital in London, the oldest and the best eye hospital. They said his eyes are the beautiful eyes. Today we know, there's a nice study if you want to know. Nobody is putting dark glasses inside. Using the dark glasses is one of the ways you are preventing the ultraviolet rays from the sun entering your retina and making your eyes good. And you will be surprised. The ultraviolet rays of the sun going through the retina stimulate your pineal gland, which is the master of the whole orchestra of endocrines. So half of your problem is because you put on some of our politicians put it on at night also. Because they can't look you in the eye. You know, it's so nice to look at the sun, so nice to be in the sun. I take an opportunity in the airport and all, and the queue is there for getting into the plane in some southern, very hot sun. I will be the last in the queue because I want to get more of the sun at least, because otherwise we are all the time inside the house. We don't go out. I tell women, just sit in the sun for 1 hour in the morning, 1 hour in the evening, go for a walk. you don't have to take anything for your bones. Your bones will be fine. And this people don't do because ladies are afraid. Sunscreen is the cause of skin cancer. Government permits the sunscreen. So we don't want diseases to go, because if diseases go away, what will we do? Truly true. So, now coming back to this caste system, in the life positive movement, let us end this caste system. Let us get everybody who says he is a healer together into on one table. And it can't be done independently, because if you talk to a allopath, or what you call allopath, everything is allopathy, remember that, except homeopathy, all things are allopathy. Ayurveda is also allopathy. Now if you ask a Western doctor to suggest an Ayurvedic fellow for a treatment, he won't do that. And you can't ask them to come together. What we do in our research center in Chennai is, when we find we can't do anything for a particular person, we know some Ayurvedic people and homeopaths who are very good, and we call them and say, look, take charge of this patient. And what we do is we record all the things and send the patient there and record the outcomes also. So we're building a big database, and we have a few people. There's one lady in I won't tell the name because it will be advertising her. She can do very well for renal failures. See, America, I want to send her to America, because in America there is a rule now, though we say Western medicine is very good, no? If you are 65, you are not given a kidney transplant, even if your kidney is failing. For the rest of your life, you will be on dialysis. And dialysis is such a nasty thing if you want to be on. If you are 65, no transplant. This is the medicine that we practice. What we should do, and Ahluwalia ji should strive to do this, because, you know, for all these things you need money, man. Without money, nothing happens. Money is the thing that runs this world. And I always say, money is the cause of all diseases. Did you know that? No, you didn't know. I'll tell you this study. There's a nice study which shows that. If you have a money, you must push this idea. We must get these people together and have a database which says who is good for treating what. A lot of people claim, oh, I do this, that and all. I'll tell you a recent example. We had a nurse whom Karthikeyan knows, Rama. She runs our whole research center. This girl had an upper respiratory infection, I tell you, fever, etc., etc. She took all the antibiotics and all. She was in bed with such bad sinusitis, this and that. We have a homeopath who is very good in this area. So we sent her to that homeopath. 3 days later, she is back at work. Absolutely fine. I called her yesterday and said, Rama, how are you? She said, I'm fine, sir. Fit as a fiddle. 10 days she suffered taking antibiotics. Each antibiotic pill you take kills millions of germs in your gut. And when the gut is damaged, your immune system is gone. The headquarters of your gut is in the immune system. That's why in America now, if you have a very bad infection with superbugs and nothing helps, do you know the treatment? Give someone else's shit through a Ryle's tube. And when once you replace the gut with the normal flora, the infection disappears in 4 hours. This is called fecal transplant. So America does it, so we accept it. Now we've gone one step further. In America you get poop capsules. Small capsules, $5. So it boosts your immune system. That is the strength of Ayurveda. What does Ayurveda say? Panchakarma. In Panchakarma, you only boosting the immune system. I have a Western medical doctor, a professor of radiology in a medical college in Maharashtra, who had a massive heart attack. And they did everything for him. Bypass surgery, this, that, but he was not able to get up from bed. He said, I am going to use the Ayurvedic method. He caught hold of cow's colostrum, which is a very good immune booster. And he has produced a tablet called Immugen. And he has now got back. He doesn't take any medicine and he is absolutely fine. He has left the medical college and he is doing this business of selling immune boosters. So happy. His ejection fraction has come back to normal. He is 24 hours, he is working and he has forgotten his heart. He is heartless now. That is the power. But then you should know when to mix, when to combine. If you go on saying that across the board, I'll say all systems must come together, nothing will happen. Because they hate each other like, mouse and the mongoose and the snakes. So because, what is the hatred, do you know? I'll take you to history, because history, you learn from history. If you do not, you relive history. 50 years before the American Medical Association started, doctors in America thought their methods of treatment were so bad that they wanted to homeopathic association. So the first homeopathic association in America started 50 years before medical association started by American MD doctors. And who was Heinemann? He was an MD doctor in Germany. He couldn't save his own son when the needle went into him and he gets septicemia and died. This man thought, what's the use of my MD degree? I have not been able to save my son. Then of course he copied from a Canadian doctor who had written a book on this, similibus something something. And it was not originally his. And always in history, the man who publishes a thing in the world gets the credit. Nobel Prize are also like that. The man really who invented doesn't get the credit. So that Canadian man didn't get any credit. Anyway, homeopathy exists. Now homeopathy also has got certain advantages. It has got a lot of problems. Modern medicine has certain advantages. Let me tell you, supposing I fall down under the car in Delhi roads, I can't say I'll do yoga and sit and do Om and then get back. No, somebody has to set my bones, somebody has to do something. But then what we don't realize is, youngsters who go without a helmet in the road, I tell them, nobody can help you if your head is broken. Doctors cannot do anything for brain injury. We just hoping against hope that something will happen. If the patient recovers, we take the credit. If the patient dies, we give the credit to God. He always kills and we save. So have a helmet because nobody can save. Now these kind of things modern medicine can do. We can't throw modern medicine out of the window because the water in modern medicine is bad. I don't want to throw the baby out. I still want to keep the baby. But modern medicine also requires a lot of refinement. I'll give you an example. In Vietnam War, America had a 5-star hospital 10 minutes from the war theater. So a grievously injured soldier is lifted in a C-130, which in itself is an ICU. The C-130 which lifts these people is an ICU. So starts blood transfusion, etc. immediately. So he's taken to the ICU, 5-star treatment. Poor British had a war in Falklands. No enemies, no friends in South America. And then the whole patient had to be shifted 16 hours to London. And some of the patients there were left on the snow, grievously injured patients, for as long as 24 to 48 hours. Because the war occurred October, November, December. Now, audit now shows that per capita death of comparable grievously injured soldiers was slightly more in Vietnam than in Falklands. People are working now. Scientific brains are working as to why it happened. One of the reasons is, you immediately interfere. Nature has provided a beautiful system inside in injury. You and I were in forest. We were hunter-gatherers. Tigers comes and tiger eats. Tiger can't eat the whole of you. It doesn't have the appetite. It will eat maybe your hand. Did I say anything wrong? Can you see an electron? Huh? You can? Have you seen, sir?
All the diffractions, you are living with electrons all the time. And
That's a different thing.
it is proved beyond doubt. So there is
That's a different thing. My question, no, wait. Answer my question. Have you seen an electron?
So this is not a relevant question. Because
Acha, okay. The question itself is irrelevant. But nobody can see an electron. How do I see you, sir? Physics-wise, how do I see you?
you are seeing me through electrons. Basically, the electrons are activating your retina.
Okay, all right. A few photons leave your body and strike my retina and I see you. If one photon leaves an electron, the electron is not an electron. Anyway, my interpretation is very simple. You can't see an electron, you can't see God. But anyway, let's not go into God. Nature gave us an autonomic nervous system. Most of our health problems are because of the autonomic nervous system today. In the forest, you saw the tiger, and when you saw the tiger, you are frightened, you want to run away. To run away, you require glucose. So there is no glucose aid in the forest. So nature said, okay, I will give you gunny bags of sugar in the liver called glycogen, from where you get your glucose. And for that, its sympathetic system produces adrenaline. Adrenaline goes to the liver, sugar is released. It's called neoglucogenesis. A biochemistry professor will tell you. Neo means new, gluco means glucose, genesis is birth. Now the sugar goes up, you can run. Your blood pressure has to go up, so adrenaline increases the blood pressure, vasoconstriction. Your heart rate has to grow up, chronotrophicity, heart rate grows up, and you run. When you run from the tiger, if you survive the tiger, your whole thing comes down. You're up. The sugar which has gone up has come down. The sugar, blood pressure comes down. Today we have transformed ourselves into society. Here there are no tigers, but there are human tigers here. Your husband may be a tiger, your wife may be a tiger, your boss may be a tiger, your assistant may be a tiger, your peon may be a tiger, your driver may be a tiger. When you look at these people, your blood pressure goes up, your sugar goes up, but you can't run away from them. You got to stay there. And when you stay there, they remain high, and over a period of years, you become a hypertensive, you become a diabetic, you become, all these things. All these things can be managed by change of mode of living. 1733, there was a young professor of medicine in Vienna. His name was Charles Schmitz. This boy wrote the first textbook of medicine where he said, I have seen patients with vehement agitation of the mind and chronic constriction of the vascular bed. And when they die, I look at the heart, it's like a bull's heart with so much of thickness. Now very interesting. And what was the treatment he suggested in 1733 textbook? Change of mode of living. Tranquility of mind. And the third, drugs, if ever, rarely. Full stop. If you do that same thing today, most of our hypertensive diabetic patients will completely become normal. You just look at the science of giving a chemical drug for lowering your sugar, lowering your blood pressure. What does this do? Nothing. Do you know what helps? The placebo effect. The faith in the medicine, faith in the doctor that I have taken the medicine will lower your sugar. You may wonder, what is he talking about? Someone will say, I'm a doctor, so I can argue till the cows come home that you are wrong. There's a study done in 4 universities, Oxford, Cambridge, Munich, and Hamburg, where they gave morphia drip. Morphia is the most powerful painkiller. Morphia drip for patients with severe pain. But while giving, they explained, this is a study we are doing. This is not morphia. This is a drug which will improve your health, but not your pain. We are just seeing what is the effect of that new drug. Nobody's pain went. What was running in the drip? Morphia. So they took a crossover study. The same patient was taken over the other side, and they were running what is called saline. Saline is salt water. And they told the patient, this is the recent salt of morphia, very powerful. Your pain will go, pain went. So they were nonplussed. So what did they do next? They said, we'll do fMRI and see what the brain does. So they did an fMRI and repeated the test. When the patient believed the doctor that it's not morphia, his brain slept. When the patient believed the doctor that it is morphia and what was going was saline, his forebrain produced so much of powerful opioids, much more powerful than opium, and the pain disappeared. This is called the placebo effect. You want to know more about it? Write down. The placebo effect. That's the article's name. The first author's name is Bingel, Professor Bingel. He is a professor of medicine in Oxford. And the journal is a very prestigious journal called Journal Science Translational Medicine, STM it is called. Science Translational Medicine. Year is 2011. Semicolon. Now what is important in this study is, it's a mind that tells you that look, you are okay because your doctor has given you this medicine. So it doesn't mean whether it's Ayurveda, Umapati, Ayurveda, anything. As long as the doctor commands the faith of the patient. Many of us demand the faith of the patient, which is not coming. He must command. The minute he says, doctor, you are God, do what you like, I'll be all right. And he will be all right. So it's the placebo effect, ultimately. Enama? Kadichada? You may say, okay, this may be for medicine, but surgery? Surgery certainly, I know, we are doing very well. Surgery certainly is good. One of my former chiefs in Harvard did a study. He is about 94 now. He even now conducts studies. He's alive and healthy. He's the man who invented that shock you give to patients in the defibrillator. It's called Lowndes defibrillator. His name is Bernard Lown. He's a Nobel laureate. What he did was, over the last 5 years, some 600 patients were sent for bypass surgery. Those days we were doing it with a laser tip. And bypass surgery, what's called transmyocardial revascularization. So he said, none of these people require it. So one by one as they came, first one went to theatre A, second one went to theatre B. And in theatre A, the protocol was anesthetize, operate, send. Theatre B was anesthetize, keep him lying down there for 1 hour, wake him up, and then tell him you had a wonderful operation and send him home. Do you want to know the study's results? These people who went to theatre B, they're all fine even now. Thallium study showed their myocardium is completely revascularized. And those who went to theater A, the first 30 days after myocardial infarctions, revascularization, a lot of people die. It's called the 30 days death rate. Here there are 2 people who died in B, 8 people died in A. And now, other than the 2 people who died, rest of them are all fine. And on the other side, half of them had open bypass surgery after that because they had intractable pain. One half of the other half, they are in heaven with their maker. The other half of the other half is having ADR, adverse drug reactions. Yes, sir. Just place there. So, even surgery to a great extent is a placebo effect. I have had surgery, that's it. They are fine after that. Is that right? You want to know that? First write down the author's name. Roger Laham. He is Bernard Lowndes' first assistant. Roger Laham et al. Et al. Is and others. Okay. The study is called Laser Revascularization of Coronary Artery Disease. Laser Revascularization Coronary Artery Disease. Okay. Journal is called Journal of the American College of Cardiology. Journal of the American College of Cardiology. JACC it is called. Year is 2005. Volume is 42. And page is 1822. Now, very interesting, this study you must study and see how the mind works on the body. And where is the mind? In the heart. Where is the mind? Never mind. The mind is not in the brain. All that you should know is mind is not in the brain, and mind is everywhere, and mind is consciousness. So consciousness is mind, and we have 2 kinds of things. The same thing in Sanatana Dharma, Atman and Paramatman. Your mind is your individual consciousness, and the universal consciousness is what we call as God, but it's energy. God is energy. God is love. Universal consciousness is Paramatman. So the same thing happens in science also, if you understand. And the consciousness works, and consciousness is the thing that runs the whole world. So if you understand that, all of us are relatives, very close relatives. And we should love one another, not because it is good for others, it is good for us. Because our own cells, if you look at them with the biophoton camera, they love one another, they speak to each other, they communicate with one another, and they're dancing in sync. You are healthy. If one part of the cells are not happy, you are having a disease. So disease is not organ-based. Heart disease, lung disease, brain disease, head disease, leg disease, no. It is in the body. Remember that. And a professor of medicine in Yale, she's a very intelligent girl. Her name is Mary Tinetti. She has written a beautiful article in the Archives of Internal Medicine called The End of the Disease Era. The End of the Disease Era. It's not archives, it's American Journal of Medicine. Write down that, you read that. Mary Tinetti, M-A-R-Y-T-I-N-N-E-T-T-I, Mary Tinetti. And her assistant's name is Steed. Steed is also an author. S-T-E-A-D. The journal is American Journal of Medicine, AMJ. And here is 2004. Volume is 116. And page is 179. Now very interestingly, Mary says the old idea of disease, diagnosis, etc. has to be given up, because if we apply that to the modern system of medicine treatment, you are either over-treating, under-treating or mistreating. So most of the time we harm patients by our conventional treatment methods. So to put it in a nutshell, ladies and gentlemen, what we need is a future new system, which is an integration of the good in all the systems. The systems should not have hatred, like, one caste hating another caste, one upper caste, Brahmin caste, and one lower caste, and things like that. So modern medicine is not upper caste. All are same caste, human caste. And we must have a common platform where every patient can access the resource from various systems as and when he wants, with some guidance from people like Ahluwalia or somebody, who can put the systems together. Even Tony is trying to do a big thing on, he's got a an organization where he's trying to put things together. This I have written about years ago as what's called meta-medicine. You know, physics was written by Aristotle first, and then he wrote psychology. That's why psychology is called metaphysics. After, meta is after. So meta-medicine is medicine after the so-called modern medicine, which is a conglomeration of all systems without caste system. So every system has its very important things. Like, for example, homeopathy, let me tell you. Somebody did a wonderful study in Glasgow University on 2 drugs in homeopathy, arum triphylatum and Sambucus nigra. And they showed there's a such powerful effect on viral infections, especially the upper respiratory infections, which you think may be a minor thing. In Europe in winter, on a given day, 50 million people do not go to work because of feverish cold. There's a subtle difference between common cold and feverish cold. Common cold is caused by rhinoviruses, feverish cold is caused by adenoviruses. But today we use the virus to frighten people and mask our sins. Zika is a new example. Everybody is frightened. I get about 20 emails every day from pregnant women. I am pregnant. They say Zika is coming to India. Will my child have a small head? I said, your child will have a big head. Don't worry. Zika has not done anything to anybody so far. Zika has been in existence from 1947, and to the best of my knowledge, it has not killed anybody. But Brazil, what happened is, Brazil, I don't want to tell the name of the company, the spraying of chemicals on the food and food plant growth is so much that 473 children suddenly had microcephaly when they were born. Each one of them had about 200 chemicals in their umbilical blood. Now the company doesn't want this to be published, so they caught hold of the government and said, now the Zika virus is there, why don't you connect that to the Zika virus? When they did the study, out of the 473, unfortunately only 2 kids had some antibodies against Zika, because Zika is a common thing. You and I can have Zika virus antibodies. Suddenly the government said, Zika virus is the cause. So the WHO got into the act, and everybody said, Zika, 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 Zika. And I tell you now, pregnant women in the West are terribly worried, because the vaccine company has come up with a Zika vaccine. This is how the world runs. So let us love one another. If you love one another, you don't want to encourage cancer, you don't want to encourage Zika, you want to encourage people to be healthy. And you and I, we have wasted all our time to come here. I am sure your idea is to help humanity. Am I right? And we should try to find out the truth. How do you find out the truth? Go deep into it. Otherwise you will never know. You will never know. I am not saying Ayurveda has no problem. Ayurveda has a lot of problems. Do you know why? The Ayurvedic doctors are a menace to society. They don't know what Ayurveda is. Most of them who study with BHAM, they don't know what Ayurveda is. And they think Ayurveda can treat everything. And then they give you steroid tablets, etc. That's not Ayurveda. Ayurvedic pharmacies are also not honest. Ayurvedic basmas, today's basmas you send to American laboratory, you can have all kinds of chemicals, including mercury and things like that. Do you know why? The real Shastra of Dravya Sutra is you prepare this Ayurvedic basmas by sealing it in a mud pack and keeping it under the earth, dig it down and put it there for 12 years. In 12 years, there's what's called anaerobic cooking, and every metal becomes nano and picoparticles, and nobody can detect a metal and doesn't damage today's basmas damage the kidney. So nobody is honest. Homeopaths. I met a homeopath came to me and said, sir, I can treat hypertension with my drugs in no time. I said, fine, you have a record, get it to me, I'll publish it. He said, I'll come. He never came. And he doesn't have a record. See, this is where the problem is. A lot of homeopaths say, I can cure cancer. He doesn't know what cancer is. He can cure cancer. When a Nobel laureate biologist doesn't know what cancer is, Albert Szent-Györgyi is a Nobel laureate biologist who has written this book called Introduction to Submolecular Biology, where he says, I don't know what cancer is. Because the cancer cell works exactly like a normal cell. And I cannot make a distinction between a cancer cell and a normal cell. And you can't kill a cancer cell without killing an equal number of normal cells or more. Who is writing this? Nobel laureate. And a 2 Nobel Prize winner, Linus Pauling, says, the whole cancer industry is fraud. Cancer research is fraud. Cancer charities are fraud, he says. Not once, several times. So, there is this filth everywhere. Whether it's Ayurveda, Yajurveda or Umapati. Making money, if you think is your aim, you are a fraud. But helping society is your aim, you have a lot of opportunities. Thank you very much for giving me this opportunity to express my thoughts, which may be foolish. A lot of it may be questioned. But I would like you to question it by finding the truth. And that will be a great thing. And I've given you some sources to read. Please read them. And all of you must read this book, beautiful book, written by a professor of history in London. The book is Bad Medicine. What is the book's name? Bad Medicine. Subheading is Doctors Harming Patients Since Hippocrates. Doctors Harming Patients Since Hippocrates. And who has written that? David Wootton. David Wootton. Wootton is a professor and head of the Department of History in the Liverpool University. He's a brilliant chap. He's written a lot of books, but this book is one of his best books. So please read that book. I think 2006 or 2007. Oh, you put Wootton and Bad Medicine, it will jump out in Amazon and come out and give you the book. Wootton. Wootton. O-N. O-N. O for orange. A for apple. Okay. Now, if you have any quick questions, you can ask because keynote or no note doesn't matter. If I know the answer, I'll give it to you. If I don't know, I'll try to let you know later.
Very simple question. What do we do now?
That's a good question. That's a fascinating question.
Everything is fraud. I mean, I am a diabetic on insulin. Is it only a placebo that if I stop insulin, I'll become all
If you are not a type 1 diabetic, if you are not a childhood diabetic, I think you don't need insulin. But today's company's law is everybody should take insulin so that you are controlled very well. And they'll come with the insulin pen. Have you bought one? See. Because each pen prescribed gets registered in the computer of the pharmacy. And then the fellow will come and say, Madam, your doctor, you have written the number of pens. You are our best bet. Next, visit, you will have a cruise from Alaska with your wife and your children and all. And then when you come back, we'll give you a Maruti car and things like that. So won't I be very interested in doing that? And they get their speakers. They'll give you such a nice lecture with beautiful slides all made in the company that you think if you don't give insulin, patients are going to die. No, what do you do? I didn't treat you. I didn't give anything. I only said this is how it happens. You may wonder as to why suddenly there's a resurgence of insulin's interest. Because the companies are interested in insulin. And do you know they are interested in keeping you a diabetic? That is why they ask you at $1 million to eat chapati. Are you making chapati at home? See, what is happening is the wheat has gluten in it. And gluten directly damages the beta cells in the pancreas. And gluten keeps you a diabetic permanently. So that you become a permanent patient. The best treatment is the millets. Millets have a special vitamin called vitamin B17, which is called Laetril. And Laetril, from cancer to common cold, it boosts your immune system. And there is a doctor in Mysore. He is a very highly qualified agricultural doctor. He left a big company in America, big salary. He has come and he is growing these millets in a 5-acre plot. It doesn't require, millets are very interesting. They don't require much water. Ragi, Navane, Bajra, Seve, Jawar, all that. And he is treating patients with diabetes and hypertension with only this. He has got a clinic, free. You go there, he'll give you all the nice things made out of Mysore.
What is the name, sir?
Kader, Dr. Kader, Khader. Kader. Khader. Very nice man. So, it's a very good method. Continue doing it. But keep a record of what you do. And if anybody has side effect, record that also. No. That's easy to say that, if at all. Because for the future, you must be honest. Record keeping must be authentic. Huh?
Okay, I think can you talk a little bit about the whole field of energetics and particularly occult?
Okay, that's a good question. Well, I didn't specifically talk about that because our physicist is there. Now we have these known energies, electromagnetic energies. We have electromagnetic energy. I have been playing with it for quite some time now. It originally came from NASA. In NASA, they were using electromagnetic energy, their sun's energy, for rejuvenating the space people who go there. When they come back, they used to be paralyzed in the olden days. You would have seen in the early part, they were taken on a stretcher to the hospital. Today, they jump out and walk. That's all because the electromagnetic energy being used. So we have been using it for treating diseases like any ischemia, heart attack, brain attack, or any inflammation like, arthritis and things like that, or broken bones. And we have wonderful results. We have got all the records, and I have got a small little device now. I have invented that. Using the NASA's game plan, we have made a small little device which is called the EM Pulse. And this is just sun's energy, but what we have done is we have pulsed it so that it doesn't continuously go and heat the system. So it's remarkable. Like, for example, you have say, facial paralysis, what's called Bell's palsy. In 2 hours, I can make your face come back to normal. If you have a stroke, you can get it within 48 hours. Heart attack, 24 to 48 hours. It can do all that. But we are trying to expand it and see what it does, and with some success, like Parkinsonism, where the degeneration occurs. In degeneration, it's not very effective. In damage, acute damage, like cell damage. But if your cells are all dead, it can't do nothing. That's one thing. Now about occult energy, our group has done one study, which is yet to be published. And this is a very interesting study. If you want to know, I'll tell you. This man is a professor of radio therapy in the University of Irvine in California. His name is Joey Jones, Joiejones. Joey got some grant from NIH to do a study on pranic healing and cancer. Joey is a cancer specialist. He's the head of the Department of Cancerology in the same university. Joey had cancer himself, and he didn't take conventional treatment. He got treated by the pranic healers, and he's fine. So Joey started this study where we have got this cell line called HeLa cells. You can grow cancer cells in the laboratory and irradiate them in gamma rays. They become cancer in a week or two. So he did that. Then covered that with a Faraday box. Our professor of physics will tell you that no energy can enter a Faraday box. To be certain, he also put a lead cover and then called the pranic healers to pray for them. Okay? So the pranic healers sat in his laboratory and prayed. It has got some other very interesting anecdotes which I won't mention now for want of time. And then he found 88% of the cells becoming normal in 2 weeks' time. This is the first study of human cell line cancer being treated by occult energy called pranic healing. It must be done by genuine pranic healers. Amerindian pranic healers are very powerful people. Now this man was not satisfied, though we were very happy and we were telling him, you are fine. He said, no, it must be 100%. I don't believe in this statistical 88% and all. So he said, why 12% have not? And he is a great proponent of Indian philosophy, Sanatana Dharma. He said there must be some reason, some karma on these cells. They have not. So do you know what he did? There were 3 observers from NIH because they were given $100,000. So they had come to see whether he's eating the money or doing something. He told the observers, each one of you write a check for $100, your own money, tax-paid money, genuine money, not black money, white money, and give it for a charity and pray, let the good karma of my charity go to the cells. Would you believe second time, 100% of the cells became normal? So you clapped, but the poor man is in jail. Because his colleagues filed a case against him, saying that he has done something which is not scientific, quote unquote. It's hocus pocus, and he's diverting science attention. He's wasting the government's money, and the poor man is in trouble. His wife calls me and says, no, nobody to fight his case. See? And she says, I've got all the documents, all the ledgers, please publish. Now I said, if he comes out of the jail, he has to write it, because if he writes it himself, it's very good. This is the world. In the world, The only casualty is truth. Though we say Satyameva Jayate, but what we are doing is Anratameva Jayate. Na Satyam. Yes, Sardarji. I know that crystals. Yeah, that I have seen, I have even communicated with him. But they are all there. Such stress is there. But this is a human healing I'm talking about. Said, Tom, now you have become the president. Stand up, speak up and shut up. Thank you.